Hey everybody, this is Living with Problems. I'm going to be getting my sterile field essentially, well, I've got it ready. I'm going to be unpackaging everything and getting it ready for a indwelling catheter change. I do have a catheter here. It's a discontinued Raylene one using this size 18. Let's get that out and ready. I do have sterile gloves underneath. Bag. Flip through. Catheter leg sleeve. And we've got most of that stuff out. Next bit's sterile bit, more so, to some extent. Extra numbing lubricant if needed. Already got in here. Chlorhexidine. That's just my preference for the sterilisation. That is Optilube. That's for the numbing, which you just seen. There's more there in case it's needed. And this is a catheter that only requires 5 mils, which I've already got ready and prepared. I've obviously used Angel Blue microbial hand gel preference before gloving up. I've got sterile gloves underneath, and then I have nitrile gloves over the top. That's just my preference. I have a latex allergy. They look like latex, but they're not. Anyway, got cotton balls in there, got tweezers in there, got some gauze in there. Really easy to use. Not exactly a pain in the ass, which is great. So I'm going to take off these ones shortly. I'm going to then proceed with the next part. So I usually will just go like that. Yeah, okay. Technically I broke sterile field, but you know, I'm only sitting up. Actually, technically I have an extra set of gloves for this, so this is just for filming to make it a bit easier for you guys to actually see what I'm doing. Usually I wouldn't film such a thing, but hey, you know, not many people bother, so let's see how that pans out, shall we? Grab out gloves, because we don't want, not the gloves, the tweezers, because it's just easier. Usually separate the balls, the cotton balls away from everything else. We usually part the gauze. Sometimes it's like 5 pieces, sometimes it's 2. It depends on what set you get with a catheter change pack. This is just preference. This is plenty of balls, cotton balls and gauze to use to sterilise the area before doing anything else. So I've got that. I've got my chlorhexidine. Get it all over everything that's necessarily needed. Make sure it's very well soaked so then you don't have to worry about dry spots. Yeah, we've got that all sorted. Next we'll sort out the bag. So these bags are Hollister 800ml bags. They are usually in the open position. Reminder, always shut them before you actually connect them to yourself unless you want to pee everywhere. Just not slightly. I've seen a lot of nurses do that and it looks rather awkward and not so entertaining. I use the 50cm lengths. That's just my preference. You can use 10cm. You can have it shorter or longer. I prefer it longer, mainly because I use the sleeve with it. So I'm going to connect a flip flow valve to my bag. as preferred. It is just easier that way. These are a real pain in the ass to actually put on, but using one does make things a bit more independent. I would normally use an intermittent catheter, but I'm having some complications, so I'm going to use an indwelling catheter at this current moment, because my needs have changed again. I've had chronic urinary retention, formally diagnosed January this year, but prior to that, the worst incidence was August last year, being 2023, was because I went in retention for 2 days and had absolutely no idea, and there was no signal to my bladder and brain saying, hey, you need to go pee, and they got out like close to 800 mils to a litre in a rather rapid fashion. They started me off with a 14 size catheter, eventually then went to a 16 due to clots and sediment, and well, this is an 18 that I'll be using, but they've discontinued this brand. This is the Reeling brand, so this bag is a Hollister bag. I prefer this one. I usually can go overnight with an 800ml one. At night time I will usually, if not using a flip flow, I don't usually exceed 800 mils. Some people prefer to use 1000 mils, some people prefer to use 2000 mils, or for reference 1 litre or 2 litres, whichever you want to prefer that, to be set in. So these are all set up. It's facing in the up position at this current moment, so we want to flop it down to the down position, so then it goes down the tubing. So as you can see, it's facing down. So don't really need the lid again, no point, until you're throwing it out. Chlorhexadine's all set up. I've got my water there. And I've also got the numbing lube there. Now with this one, move that out the way. This is the one you want to make sure you're very, very sterile with. Only because this is going inside you. Well, this bit not, this bit is. So what I usually prefer to do is open up the end by carefully holding it so it doesn't slip. And I will open it up like that. And then I will grab some of the numbing lubricant and I will squeeze it in where the tip is. So, as you can see, the tip is in that side. It's coming out, but that's fine, because that's what I wanted. Okay, that just went everywhere, but that's fine. So the sterile feels full, so it's all good. Anyway, we want to get that tip in there. All of the lubricant is to make sure, and I usually give it a bit of a squeeze to get it at least, I don't know, good 5-10 centimetres on there. And then I will set it back down like that until I'm ready to use it. So then it stays as sterile as possible, and then place the lid back on there, like that. So now we've got the lid back on. I will keep the amount that's needed for the balloon in there. For this catheter here, the Reeling size 18, I need 5 mils. It actually says on the packaging, which is very, very handy. Obviously those ones have been discontinued, but you know, that is what it is. So essentially, that's all set up for me to go. I've got everything I need here. Don't critique me on my sterilisation. If anything, I'm overdoing it. Because this is being done on myself, I am dealing with my own, you know, germs and bacteria and all the such. Usually the chlorhexidine quite well does the job. I sanitise in between absolutely everything. And I also do a glove change. So obviously I've set it up with sterile gloves, not using the noggin obviously, but I then take these sterile gloves off because I'm filming, and I'm then going to change gloves again, put sterile gloves on. I will then put what you would call bluey, but it's pink. I then put that underneath myself, give myself a good clean with the chlorhexidine using the tweezers Then after I have done that, then I will make sure that everything is ready to go ahead with inserting the catheter inside myself, and then making sure that this part's empty here. What you can do, which I actually find really helpful, is right as you're about to put the catheter in, before you even do that, is attaching the end part, which is still in here in the sterile field. It might be hard to see because, yes, it is white. I'm not going to pull it out, obviously, because I'd like it to stay sterile until I change my gloves, and then I will go ahead with it. I can include photos at another date because I haven't figured out how to do that just yet. I will usually attach the bag and the catheter together. Now, with most registered nurses, or RNs for short, or even an EN, which is an emergency nurse, they won't do that. They will let it drain into one of these to make sure it's draining first. I will just check the bag. If it's draining in the bag, it's draining. It works, people. It works. Anyway, if you are interested in knowing anything specific about any of the products I use, feel free to ask. I go back and forth between catheter supplies depending on my needs. I have no intention of a suprapubic catheter. I am highly objective to that for personal reasons. Now, most people would use straps. I actually prefer to use a leg sleeve. The colour usually indicates the size, but if you change brands, don't believe the colour's the size. Please, I made that mistake. And I got the wrong size, and my thighs obviously don't agree with it. I was like, nope, too tight. No thanks. But these actually make it a lot more comfortable to actually wear the catheter. I wear it on the upper thigh, but that's my preference, obviously. Everybody's different. Some prefer to wear it on the lower leg. Some prefer to wear night bags all the time. Some will wear day with night. For personal reasons, I usually prefer to wear the 800ml bag all the time. I don't always wear it with a flip flow, but I choose to wear it with a flip flow at this current moment because I'm going between intermittent catheterization and, using an indwelling catheter, which is what we've got here today. I've got multiple reasons why I need to use catheters, and I've chosen to share this because there doesn't seem to be much of anything online about catheters. I think there's a lot of people that don't have the confidence to do this. Me, I've gone, okay, screw it, I'm stuck with this for the rest of my life. Let's talk about it. Let's actually educate the future generations on how this goes. I am a mid-30s female residing in Australia. I have no shame in this. I don't care what people think about my disability. I don't care what their opinions are on this. If you don't like this video, clearly don't watch it. Not my problem. But I'm actually rather confident with this. I do my own catheter changes and have been doing for majority of this year. So we're now in October, so that is, 10 months. I lasted for a few weeks using intermittent catheterization, but today my body is not sending the signals to be able to do that, and it's becoming very difficult, and it's a risk of a urinary tract infection, which is really not very nice and usually requires antibiotics for some people. Sadly, I'm getting sick of antibiotics. Who likes them? Who doesn't? But I just thought I'd give you a bit of a interesting video to have a look at to see what I do with my catheter, and hopefully I can answer the questions that you do have. It does vary from country to country what references you do use for each product. My lubrication method is numbing lubrication because I find it a little uncomfortable going in. I do use a magnification mirror to do it, although sometimes I can freehand it, which is called blind cathing, which some of you may already be aware of. And that method seems to work most of the time, but if it's ridiculously numb, well, who's going to find it? You've got to be able to identify where your urethra is, otherwise trying to do something like this independently is actually going to be impossible. Or at least use a mirror. You can ask your medical professionals to show you how to do it. Some will say no, some will say yes, some might not be very comfortable with the idea at all. I'm not going to show myself inserting this at any given stage, but I do use a treatment that helps with my bladder when I have sediment or blood clots, and I will do a video about that on another occasion. It's actually really easy to do. You do not need to be a genius, you need to be shown how to do it. They have a basic video online, but it's not very educational, it's not very helpful. The instructions can be a pain in the ass. In all honesty, there's no directions for your body. You do what works. Sometimes you have to improvise, sometimes you don't. Me, sometimes I will improvise and I will find a better method than what is used in the medical field. I'm not in any way a qualified RN or EN or of any such or any type of urologist. I'm actually just a human being just like you, most likely. If you're a medical professional, please don't judge me. I've been doing this long enough to feel confident enough to put this up here. It takes a lot of guts, I guess, in my opinion, to post something and share something that's going on in your life this private, because most people don't want to or don't feel comfortable. Me, on the other hand, I'm just going, okay, stuff it, I'm going to share it. So, enjoy the video.